And this is our regular stay-at-home lecture. And I'm Tim Nutt, Director of the Historical Research Center at UAMS. And the Historical Research Center is the only archives in the state that's dedicated to the preservation of the health sciences in Arkansas. We were established in 1978 and are home to artifacts of all sorts, as well as rare books, photographs, archival collections, such as the collection of Dr. Joycelyn Elders, Dr. Edith Irby Jones, and other health science professionals from Arkansas. And while we're talking about that, I'd like to encourage you, if you have any materials that deal with any aspect actually of the health sciences in Arkansas, we would love to help preserve those materials, especially those that are that document the pandemic right now. So flyers that tell you to stay 6 feet back, tell you to wear your mask, any journals, any diaries that you might have kept during this time, and even the masks, if you're not using those anymore. If you'll wash them and let us know, we'd love to keep those, some of those for our collection. On your screen is our contact information for the Historical Research Center. Unfortunately, we're not open to visitors right now. Hopefully, we'll be able to have some of you come down and visit with us in the near future. Also on your screen is the contact information for the Society for the History of Medicine and the Health Professions, which is the sponsor of tonight's presentation and of this series. You'll see on your screen the link to join. If you're interested in joining, and I hope you will consider joining, the membership fees are fairly inexpensive, $15 for an individual, $5 if you're a student. Doesn't matter if you're a student at UAMS or one of the other universities or colleges in Arkansas. We'd love to have you. And if you want to just bypass that long URL on your screen and just go directly to the PayPal site, paypal.me/shmhp, you're more than welcome to do that. I want to bring you just a few announcements for tonight. This is the last third Thursday presentation that we will have. Beginning next month in October, we will only have the stay-at-home lectures will be on the first Thursday of every month. So that happens to be October 1st. That presentation is going to be by Suzanne Easley, who is the Assistant Director and Archivist at the UAMS Historical Research Center. In November, we'll have a presentation on the Oliveton Benedictine Sisters in Jonesboro in St. Bernard's Hospital that they founded in Jonesboro. And then December 3rd, we'll have local architect Charlie Penix, and he'll have some reminiscences about some of the UAMS building projects that he's worked on. So I hope you'll join us for all three of those. And you'll see the link at the bottom of the screen there. That is the same link that you used to get into this presentation tonight, and it will be the same for all future stay-at-home lectures. So feel free to write that down and save it, and you'll be able to use it for the next lectures. Now tonight, we're pleased to welcome Dr. Sam Taggart, and I am going to turn on his video right now. He's still muted. But just to give you a little bit of background about Dr. Taggart, Dr. Sam Taggart is a retired family practice physician. He was originally raised in the White River Delta in Augusta, Arkansas. He worked his way through college at Arkansas State University in Jonesboro, and then attended medical school at UAMS here in Little Rock. After obtaining a medical degree, he completed a family practice residency and then spent 2 years in the Army. He returned to Arkansas after the Army and has lived in Benton and Hot Springs for the last 40 years. He retired in 2013 as the senior partner and founder of Family Practice Associates of Benton. Dr. Taggart is also an author. He's a historian. He's published a couple of novels. He's also written a history of the healthcare in Arkansas, the public's health book, which was published in January of 2013. He has been working on the Arkansas Physicians Oral History Project, and that included going around the state and collecting oral and interviewing 43 country doctors, creating a video record of their life and the practice of medicine in rural Arkansas for the last 70 years. And that research is going to be compiled, into a book to be published early next year. And this presentation is the second presentation that he is gleaning from his research. So I'm going to unmute Dr. Taggart, and I'm going to close out my video and ask Dr. Taggart to start. If we can get him.
Hit the okay.
There you are. There you
Am
are.
I there now? Okay, good. Dear friends, I think most of y'all know how dear to my heart the subject of country doctors and their patients is, but I will tell you that I've had more fun over the last few years going and interviewing people and going to small towns and going to their museums and going to their libraries and learning about the towns. It's been really, really interesting. The first lecture, our first discussion we had was on who these country doctors were, how they ended up there, and why they stayed there. Tonight, we're going to talk about, over the last 2 centuries, what have these country doctors faced? Most of the country doctors in Arkansas at this point in time, part of their training was Dr. George Ackerman from UMS. And I put a quote on the slide: in 30 years, he said this, in 30 years, what we do today may seem ridiculous, because in medicine, the questions stay the same, but the answers change. And he said that over and over again. Well, tonight we're going to talk about how the same questions have been answered differently over the last 200 years. It's fairly important to think about the fact that we aren't the first people to live in the place we call Arkansas. Next slide, Tim. We aren't the first people to live here. In fact, when DeSoto made his forays in the 16th century, there were estimates that there were tens of thousands and maybe hundreds of thousands of Native Americans living in the Trans-Mississippi, in the place we call Arkansas. These people had lived here for 6 and 7 millennia, maybe 8 millennia. And they had developed a complex pharmacopoeia and a complex set of tasks that they did that were very, very important to them. When DeSoto came, and as most of you know about the Columbian Exchange, there was a lot of disease that was brought by the Europeans and the Africans who became African Americans. Okay, and in the 250 years after that, before the Louisiana Purchase, all but just a handful of those people died off. When the Louisiana Purchase was made to be, there were probably 4,000 or 5,000 Native Americans still living in Arkansas. There were 365, 370 Europeans, and probably 65 to 100 African American slaves living in the state of Arkansas. When the Europeans and Africans arrived to Arkansas, the New World, the Western Hemisphere, had been completely separated from the Old World for 10 to 15,000 years. And so they had developed sets of diseases and different things. But clearly, all of the diseases and problems that we face as humans, many of them have their origin in antiquity, well beyond we humans evolving. Strep, staph, E. coli, Pseudomonas, a variety of other bacteria developed, were ancient diseases when we came on the scene. The Native Americans, again, I think this is common knowledge, the Native Americans died off in droves because of repeated epidemics from the 16th century through the beginning of the 19th century, and resulted in very few of those folks being here. There has always been a debate there are several diseases that will have an impact on the country doctors and their patients in the 19th and 20th century in Arkansas. The three of those diseases that are particularly important are tuberculosis, syphilis, and malaria. There's pretty good evidence that malaria did not exist in the Americas prior to the arrival of the Europeans and the African American and the African slaves that came with them. But by the time of the Louisiana Purchase, malaria, three forms of malaria and typhoid were resident diseases that people had to contend with when they came to the place we call Arkansas. Tuberculosis, again, there's been a debate, and all of these three of these things are debated. There's been a debate about whether tuberculosis was actually present in the New World, or whether there were other consequences. There has now been pretty good evidence. There were Peruvian mummies found several years ago that show that tuberculosis was present in Peru. Now, some thought that it came across from South Africa to South America in seals, which were eaten by walrus, and these people hunted the walrus and developed tuberculosis. There's also good evidence that there was a tuberculin-like bacteria identified in a giant bison from 17,000 years ago, well before the end of the last ice age. Syphilis. For a while, they thought that syphilis was purely a New World disease that was then deposited with the Old World. There were, in fact, 4 different treponemal diseases that were present in the New World. But when it went back to Europe, the people of Europe developed a significant venereal disease called syphilis. And then that was transported back and became a major problem for the people of the United States, and specifically the people of Arkansas. Malaria, I don't think I mentioned this already, but malaria was not mentioned and did not appear to be not being a resident disease prior to the arrival of the Europeans. And there were none of the genetic changes with sickle cell, with thalassemia, with G6PD that occurred with the Africans. There were none of those changes occurred in the Native American population. But by the time of 1804, malaria was well established in the American South and the American West Coast, or East Coast for sure. Next slide, please. Now, Arkansas was described at the beginning of the 19th century. There was language that was used. They used the word salubrious and insalubrious. Salubrious usually was referred to a place that was health-giving. And by the way, there was some written about Fayetteville, the area around Fayetteville and up in the mountains, as being salubrious. But the vast majority of the part of Arkansas was considered insalubrious. You came here, you were going to have the fever. They didn't know what caused it. They didn't know it was the mosquitoes. They knew they didn't like the mosquitoes, okay? There were 2 pests that were identified as being part of the insalubrious nature of Arkansas. One was mosquitoes the size of bats, and the other was horseflies the size of birds. There is good evidence that there were at least 2 judges who were sent by the federal government to help attend to the territory of Arkansas, who got off the boat in Helena or Arkansas City, looked around, experienced the mosquitoes and horseflies, got back on the boat and left and never came back. But Arkansas that was exactly what Arkansas felt like. So that the malaria, 3 forms of malaria and typhoid were endemic diseases, but they were something that you had to get seasoned to. Next slide, please. We know quite a bit about what the early country doctors saw in their office. There is a wonderful, and if you ever get a chance to go read this, it's worth taking the time to go to the Historical Research Center. A.W. Webb, excuse me, wrote a book called Medical Notes and Reflections. It's a 700-page written account of what he saw in his office or in his practice for 20 years in Chico County, Arkansas, in the early 1800s. And it's phenomenal. Many of the things that you read about in this book, even though they use different language, were the things that would be seen in a common busy doctor's office today. Childhood problems, infant and maternal mortality problems, problems with pregnancy, peptic ulcer disease, arthritis, insanity and hysteria, trauma, consumption and scrofula, smallpox. Obviously, we don't deal with the smallpox anymore. But this is also the first time that we see mention of the word epidemic constitution in writing about the health of Arkansas. The idea is that the idea of epidemic constitution was that it took a certain set of temperatures, humidity, the sun just right, the weather just so to create an epidemic of disease. And that most of these diseases that people suffered from, especially the fevers, were not individual diseases, but were simply manifestations of this epidemic constitution. This was part of the old theories about health and disease in human beings, and they would hold until the 1860s. Next slide, please. They're much like today, okay? If you listen to the news and you listen to the descriptions about COVID, some of them are fairly violent. And there were 3 significant epidemic diseases in the 19th century that had a strong impact on the doctors who practiced in Arkansas and their patients. Smallpox scared the tar out of people. And smallpox started making its emergence in Arkansas in the 1820s, and it came via steamboats. If there was a rumor that somebody had smallpox, it scared the death out of people. And they would sequester those people. They would social distance from them. They would find ways to keep them away from everybody else. There were vaccinations already for smallpox, but nobody liked to take them, and none of the doctors liked to use them. In the 1830s, cholera made its way from Europe to Canada, from Canada down the East Coast, through the Caribbean, up the Mississippi, and landed in Arkansas in 1830 to 1832. This was during the beginnings of the Indian removals from Mississippi. The Choctaws became infected, and there was one steamboat made it to Rock Row on the White River. Rock Row is where Clarendon is now, and it was one of the very first public health initiatives where the medical people began to take some responsibility. Cholera was common in Arkansas off and on for the next, there were repeated epidemics for about 40 or 50 years. On the right-hand side of your screen, for me looking at it, you'll see yellow fever. Yellow fever made its first foray into Arkansas that we can document in 1855 in Helena. And yellow fever killed people. I mean, it was like cholera now. People would get very sick, and many of them would die. There were multiple rounds of yellow fever, especially in the 1870s after the Civil War. I've always been a little surprised that there wasn't that much of it. There wasn't that much yellow fever documented during the Civil War in Arkansas anyway, but there was certainly in the 1870s, particularly in 1878, 1879. people in Augusta, people in Forest City, people in Hopefield across the river from Memphis, people across the southern part of the state, especially in the river bottoms, had yellow fever, and it scared, again, this is one of those things, it scared the tar out of people. There were other epidemics during this period of time that the people had no idea of what was causing it, but they knew. If you look at the bottom of that slide, that's called shotgun quarantine. They understood that what you did is when somebody got sick, you quarantined them because that was the most likely thing to help. Next slide, please. Now, I skipped over, I got a little bit ahead of myself there, but by the 1860s, the epidemic constitution was being doubted, and it wasn't by just one set of people. There had been scientists for 60 or 70 years looking at this idea of the epidemic constitution versus there being something causing each of these illnesses. In the 1860s, Joseph Lister and Louis Pasteur formulated the germ theory, that for each of these major illnesses, there was a germ that caused the illness. And because of their stature both in the medical community and in the scientific community, people believed them, okay? And finally, the germ theory began to be accepted. Now, in medicine, as within a lot of science, there's a thing called the information float time, but this was particularly important when it came to the germ theory. The information float time says that when something is discovered, then it is validated, then it is disseminated, then it is incorporated. When I was in practice of medicine, with the onset of the internet, we kind of felt like the information float time was -6 hours. Somebody sees something on the internet at 2 o'clock in the morning, they bring a sheet of paper and say, how do you think about this, okay? But in the 19th century, the information flow time very often was in terms of decades and a generation of physicians living and dying and a new coming along and a new education process. But this information, the germ theory, created a revolution in scientific thought and a sea change in the practice of medicine that went all the way down to Augusta and Risen and Pettigrew and the little bitty towns in Arkansas. They knew that there was something going on. It took, obviously, once they began to identify the specific bacteria and viruses that caused certain illnesses, then they turned their attention, these men, Dr. Koch and all these other folks, turned their attention to creating vaccines or antitoxins to deal with those. Next slide, please. There were 4 other illnesses that plagued the country doctor and their patients. You understand that Archibald Yale, one of our second governors, I think he was our second state governor, said that every man, when the people cross the Mississippi, all the men leave their honesty and all the women their chastity. Now, that probably wasn't completely true, but there's not any question that alcoholism and all the things attendant with alcoholism played a role, because the little towns would develop at river crossings. Those were places where you could go buy groceries, you could go get your mail, you could leave a note for the doctor to come see you, and you could buy whiskey. Okay, when there were droughts and there were famines, people drank whiskey and they fed it to their children. The first, as far as I can tell, the very first attempt at temperance in Arkansas was in the 1820s, and it was in Batesville in a Methodist church. And then from that on, Arkansas has had a love-hate relationship with alcohol. Now, we talked about syphilis earlier, okay? Syphilis also made its reintroduction back into Arkansas as the population grew. And probably most of you know this, but the population of Arkansas from 1804 to 1860 doubled about every 10 years. Venereal disease was very common, and there was no social stigma attached to venereal disease. They didn't know really what it was caused by. They knew the mercury was the treatment in the European model, and the saying was that a night with Venus and a lifetime with Mercury, and that was what it means, because treating with mercury was dreadful. By the way, we didn't actually do away with using mercury as a medication until probably the 1950s. Most of us who have a little age on us remember mercurochrome, okay? And there was still a diuretic, a loop diuretic, being used in the 1950s using mercury. Tuberculosis was another of those illnesses. Tuberculosis and scrofula were two of those illnesses, obviously caused by the mycobacterium. But they were thought to be an illness, a respiratory illness gone bad, that somebody had just not paid any attention to it. And by the beginning of the 20th century, they had identified tuberculosis. They knew they couldn't do anything about it, and that's how the sanatorium came into being. Another set of problems that had an impact on Arkansas, a really significant impact on Arkansas, and continues to have an impact today, is malnutrition, poor dental health, and a disease from then, pellagra, okay? And part of that malnutrition and poor dental health had to do with the diet was horrible, okay? It was called the 3M diet. It was salt meat, pork belly, mush, and molasses. Now, one of the problems with that kind of diet, rot your teeth out, but another problem associated with it is that that diet has a very low amount of niacin in it. So many of the very poorest of people would have pellagra, which is a lack of niacin. And once everybody got on the bandwagon about everything being caused by a bacteria, they tried to attribute pellagra to a bacteria. Obviously, it wasn't. And they discovered that it was in fact a niacin. And by the way, pellagra finally started to disappear in Arkansas in the late 1920s, when the Red Cross came to Arkansas and they gave yeast cakes to everybody in the relocation camps, who were the poorest of the poor, okay? And pellagra started going away because the yeast has a high niacin level. Next slide, please. Two other problems, and we've already mentioned malaria briefly. Two other problems were hookworms and malaria. The Rockefeller Foundation came in, helped set up the Department of Health in Arkansas, and Arkansas actually put some money into it. But the country doctors of Arkansas didn't think hookworm existed. There were a lot of them who didn't think it existed. And it took a lot to prove to them. There was studies done all over the state where they examined the stools of people in a variety of counties. They did Garland County, Hot Spring County, and Saline County, and found that 4 out of 5 people had hookworm in their stool. And the treatment was relatively simple. It wasn't easy, but it was simple. I mean, you got purged a whole bunch of times. And I think that's where a lot of our country people got to the idea that, well, every spring you need a good purging. But they were able to get beyond hookworm eventually. Malaria had been identified as to the cause, the Plasmodium, as the cause, and that the mosquito was the vector. And in the late 19-teens, they did a study in Lake Village and in Crosset. And they also did some things in Benton, but Crosset and Lake Village. And what they did was in Crosset, they eliminated the breeding places for the mosquitoes. And in Lake Village, what they did was put screens on everybody's windows and gave quinine to the people who they thought were carriers. What they discovered was that there was a 90% drop in office visits for malaria in those two communities in 1918. Now, and it cost $1.45 a patient for that to do. For, you gotta understand, there were an awful lot of doctors in the state at that point, and there was a lot of competition. And when you start cutting back on the office visits, they weren't terribly happy about that. Nothing was done until the late 1940s. So for another 20 years, the state of Arkansas had to deal with malaria, and it was an ongoing chronic problem. One of my good friends, an optometrist in Benton, talked at length about the fact that in Stuttgart, he had malaria as a child, and he was sick for 3 or 4 years. Okay, next slide, please. 1918. I think several weeks ago, Tim talked about the Spanish flu of 1918. It's hard to resist not comparing COVID-19 to the Spanish flu of 1918, okay? Now, I think most of you know, you cannot trust statistics about Arkansas health before 1943, okay? I mean, I wish you could, but you can't. The often quoted line is that 7,000 people died of the flu in the month of October in 1918. Yeah, that's probably pretty close, but you can't be too sure about that. But what they had was they had quarantine, and they had masks, and they had social distancing. Sound familiar? Okay, and that's what it was all about. There was another round. There had been a round of the flu in March. Then there's this round in October in Arkansas, which really hit rural Arkansas. The town of Pettigrew at the end of October in 1918 had not had any. It was up in the mountains, way up in the mountains, and they were about to do away with the quarantine, the statewide quarantine for holding kids out of school, not having church, not having gatherings. The town of Pettigrew had a meeting on the 28th, I think, of October, and in 4 days, everybody in town was sick with the flu. It was dreadful. It was far more deadly than the COVID we deal with today. Okay, next slide, please. There was a second revolution in rural health in Arkansas and rural health doctors. And we're always inclined to say that, well, it was penicillin or it was vaccines. I tend to think it was rural electrification, okay? Rural electrification had such an impact on people, on food spoilage, but more importantly, it gave the ability for small communities to dig deep wells, to create sewage systems that were distinctly separate from the fresh water, okay? That was so important. And the health department, Glenn Baer, who was with the health department, helped set up, I think 140, in 15 years, set up 140 municipal water supplies. You see the thing for Springdale there, water supply approved, state health department. That was a really important thing. Another thing, obviously, that was important, and I think you had a lecture 2 weeks ago, was maternal and infant mortality. It had already started to drop. There were things that were being done in the 20s. There were things that were done in the 30s, especially in the relocation camps after the flood and during the drought, where infant mortality began to drop. And it was a really, really important thing. Nutrition, again, you can't underestimate the impact of good dental care and good nutrition. These children were getting better nutrition. After the Depression, children were beginning to get better nourished. We've always tended to say that penicillin and immunizations were the big deal in life expectancy. And in fact, life expectancy in the first half of the 20th century increased from 47 to 64, and most of that predated the introduction of penicillin, and most of it predated the use, not vaccines, but the use of vaccines themselves. Okay, next slide, please. When you begin to think about COVID and epidemics in the past, you really have to put it in the same category as polio. Polio obviously got the most vulnerable people, and very often it was children, but not always. Very often it was children, and it was worse in the African American community. Polio had been going on in Arkansas since the 1930s. There had been episodes, in fact, one of the doctors we interviewed from Perryville had polio as a child, and he's survived very well and done very well since then. In 1949, Dr. Fitzhugh from Augusta, who was a medical student at the time, said he remembered there being the iron lungs filling up the hospital at the medical center, which was over MacArthur Park at that time, St. Vincent's, the hospitals in Pine Bluff, and the hospitals in Hot Springs, because there was just very little that could be done. But for the very first time, and I believe this is true, and somebody might be able to contradict me on this, but for the very first time, private and public health officials, that is all the country doctors, many of whom are county health doctors, the public health doctors, the national government, the federal government, or the state government, and the local governments and national industry got together and created vaccines and delivered those vaccines to the most vulnerable people, and that was mainly the children. Many of us are old enough to remember the Salk vaccine in the 1955, 54, 50. And there's reason for that. But then the Saving Sundays, there was a of polio that was going on because nobody was getting the immunizations, and it was especially worse among the African American children. Go over Faubus.
We seem to have lost our audio with Dr. Taggart. If you'll hold on for just a second, we'll see if we can get it back.
Tim, I'm back.
You're
Somehow
back. Okay.
I got booted off the internet. I'm sorry.
No, that's okay.
Next slide. I figured it out this time, though.
Good for you.
All right. Okay. We think about the usual childhood diseases, and we don't even talk about that much anymore. But diphtheria, pertussis, tetanus, measles, chickenpox. Prior to the 1950s, there were about 1,000 cases of diphtheria in Arkansas every year. And 15 to 20% of those little bitty kids and those unimmunized older people died from that. Whooping cough, pertussis, okay, was a common disease. And the problem with it was it didn't have the mortality. That didn't have the mortality, but the morbidity. It was called a 100-day cough, okay? Tetanus was rare, but when it did occur, death was almost certainly going to ensue. Measles and chickenpox generally had about the incidence of birth in Arkansas during that time frame. And in fact, people would have chickenpox parties, and they'd say, take your children to the party to get chickenpox so you can get it out of the way, okay? Immunizations made a dramatic impact. I believe, and I think this can be backed up. A lot of the people who worked together on making these immunizations work were the same people who worked on polio. And so by the 1960s and the 1970s, immunization became a real process in Arkansas. And Betty Bumpers and then Rosalind Carter in the 70s were able to get so many of our children inoculated. And when that happened, it changed the disease in their office. Next slide, please. We went from infectious diseases and epidemics to diseases of older age as people get into their, I think I told you, Dr. Webb didn't talk about diabetes and heart disease and stroke very much because all of his patients died young. By the 1950s and 60s, people were living into their 60s and 70s and 80s. And we began to see what the ravages of smoking cigarettes and being obese could be. We then had the ability to look at blood sugars in a real-time basis. Up until the 1950s, the ability to look at blood sugars on a real-time basis was limited to tertiary hospitals. But eventually that made its way from tertiary hospitals to small town hospitals, to doctors' offices, to patients' rooms, and to patients' homes. And they began to say, okay, we need to do something about managing this diabetes well before it becomes a major health problem, before it becomes symptomatic. Obesity is just, as you well know, is just as much an epidemic as malaria, even though it looks different. And it causes so much excess mortality and excess morbidity for people in the state of Arkansas. Heart disease, same thing. Heart disease and stroke, we didn't really talk about risk factors until after the Framingham study in Massachusetts in the 1948, and then they began to publishing this stuff in the early 1960s, and they began to say, oh my, people don't need to smoke cigarettes. 59% of the men smoked, 38% of the women smoked, and 52% of the doctors smoked, okay? How do you keep that from happening? What can you do to make that happen? And this, again, was a combination of the private medical community, the state medical communities, the major organizations, and industry. And they got together and they made it happen. Cancer prevention. I mean, I'm not going to spend a lot of time on these, but to say that these occupied the time that I was in practice. We developed these risk factors and we say, how do we get people to lead these healthier lifestyles? Peptic ulcer disease was a common disease. And when I first started practicing medicine in the early 70s, the Monday morning schedule of all small hospitals was completely filled up with ulcers, with ulcer surgery. And by the 1990s, there were young surgeons coming out who had never done ulcer surgery because of Taggart and these other, and the proton pump inhibitors. Sickle cell anemia is a major problem in Arkansas because of our large African-American population. And it's not just exclusively African-Americans, but that's the largest group of people. And it had begun to get noticed in the 19th century, and in the 1920s, they began to do more differentiating, and then in the 1950s, they began to work out the genetics of it. So there are any number of things that have acted as epidemics among the African Americans. I think you could seriously call sickle cell anemia an epidemic, okay? Now, as we have dealt with these risk factors and we've begun to see a dramatic increase in decrease in smoking, we've begun to see dramatic increases. I should go back and get heart disease here. Heart disease and stroke both. One of the interesting things about these is if you can get somebody to where they can get their tertiary care as quickly as possible. emergency medical services began to be developed in the 1950s and then in the 1960s. And the whole idea then, and they still hold this to some extent, was called the golden hour, getting somebody where they can get where they can get their care as quickly as is possible. So now we have people surviving strokes, we have people surviving heart disease, we have telemedicine, we have the crew over at the University of Arkansas Medical Center doing telemedicine. A lot of really good things happening here. Okay, next slide, please. When one set of diseases begins to disappear, another comes. We talked earlier about alcoholism, and now we have alcoholism / opioid addiction, another industry-created problem, but one that we may be making some headway on, The AIDS epidemic of the 1990s had a particularly rural flavor, even though it doesn't like it would. Many of these folks left rural Arkansas, went off to larger cities, developed AIDS, had no support system, and moved back to rural Arkansas, where they lived with their grandparents or they lived with someone who could provide them with some support. The slide on the right-hand side, the right lower side, by the way, that's my hand on the top and that's my wife's hand on the bottom. This slide illustrates hospice. Get out to the point where people are living into their late 80s and 90s and they have multiple health problems, and then they make the decision, I don't want to do anything else. And we as a health, and this has been a particularly significant problem out in the rural areas, where oftentimes these folks do not have a lot of support. Tom Frieden, who was the head of CDC for the 8 years that Obama was in office, okay, was asked in about 2015, 2016, he was asked what his worst fear was, and he said he wakes up dreaming at night about a flu pandemic, and that was so novel that it swept through the population. So our next question is, what's going to be next? Next slide, please. And the answer is nobody knows. Nobody knows the answer to that question. But we have on the earth hit in 1918, 7 billion people on the earth. Something's going to happen. And I don't mean to be a harbinger of bad tidings, but I think we have the political will. I know we have the people, and we have people, good working people, who can help us make it through it, just like this time. Okay. Thank you very much. That's all I got for tonight.
Thank you, Sam. It's good as always. And I'm going to check the chat to see if we have any questions. If you have any questions, please use the chat feature. You should have a chat box somewhere. Might not be showing up on your screen. If you look at the menu up at the top or at the bottom, wherever it is on your screen, you can type in a question in the chat box, and Dr. Taggart will be glad to answer it. There's always a slight delay for questions. So I'll get things started. While this is part of your research on Country Doctors of Arkansas, when you were doing your research and doing the interviews, did one particular theme about an illness, a particular illness, or anything show up in most of the oral histories, or was it just sort of, did the same problems crop up around the state, or did you have a common theme as far as disease?
I don't think there were any common themes. Okay, I think one of the things that happened, one of the things that I think I knew already, was that most of these people who went off to school, went back to their community, usually towns of 2,500 to 5,000. Then the town turned them into what they needed. Okay. They turned them into what they needed. And so they dealt with what was needed. I don't remember anything being a particular one thing. I think the people over in the Delta, I think we talked more about infectious disease.
Mm-hmm. We have a question. Can you see the chat?
I saw it pop up.
We have a question. Have you heard of the early doctors referring to bilious fever?
Yes. Bilious fever, intermittent fever, recurrent fever. Those were all descriptions probably of malaria. Okay. But the bilious fever may have gone over into yellow fever. I don't know. But the Dr. Webb we were talking about talked about bilious fever in his book.
And then we also have that question, did early doctors rely on Native American remedies?
Well, there are a lot of apologists within the European medical community who say they didn't, but they did. Okay. Dr. What was the guy's name who was with Thomas Jefferson? Rush, Benjamin Rush. Okay. One of Benjamin Rush's charges to the Lewis and Clark expedition, because he had the privilege of giving them some charges. He said, I want to know anything about the uses of plants, the uses of things in the environment that the Native Americans use. And they brought them back some stuff. When you start looking at the pharmacopoeia, there were pharmacopoeias in the US of the Europeans that were developed in the 1820s. They borrowed regularly from the Indian pharmacopoeias. They would not admit that they did, okay, but they did.
Anyone else have any questions for Dr. Taggart?
I can't tell you folks how interesting this subject is for somebody like me. I mean, I've just enjoyed this. I haven't talked a lot about the modern day family doctors, but I would at some point like to come and talk about them because they are a wonderfully interesting group of people.
You have a timeline of when the book's coming out?
After COVID. After COVID.
And
we've discussed this. I've discussed this with the. I've discussed this on several occasions, and I told him, I said, I don't want it out there until I can go out and promote it. Okay. Mm-hmm. Because that's really because what we're going to do is we're going to go to all the little towns where we talk to these guys, and we're going to do some kind of promotion where we honor them. And that's how I would like to do this.
Mm-hmm. I think that's the best, and hopefully you'll have an opportunity to do that soon, and COVID will go away. But well, thank you for being here. We appreciate it. You always give such an interesting talk. I want to welcome or encourage everyone to come back in October. Remember, we'll only have one presentation beginning in October. It's going to be the first Thursday of every month. October 1st, Suzanne Easley from the UAMS Historical Research Center is going to give the presentation. I will not be here. I will be on vacation. So Suzanne's going to handle things on October 1st. So if you have any questions, please feel free to contact us at the Historical Research Center. You can call or email, go to our website, and we will look forward to seeing you in October. Thank you, everyone. Thanks, Sam.
Thank you. Thank you very much. Thanks for everyone. Okay. I've seen. Yeah. Okay. Joe Crow was coming on writing something about having seen the polio. The polio was fascinating. The whole how everybody pulled together. That's just a really fascinating story to me. Mm-hmm. By the way, we don't talk. Can I mention something else here?
Sure.
Hey, Tim. Okay. We don't talk about this a lot, but Dr. Roger Boast was probably one of the most significant physicians in Arkansas as relates to polio. He was a wonderful man, and he did so much for children, and especially children with disabilities. Just a really phenomenal guy.
Mhm. Okay, I think that might be all the questions that we have. If you have any other questions, feel free to shoot me an email, and I'll pass them on to Dr. Taggart. And again, we'll see you in October. Thanks. Good
Thank
night.
you. Good night.